promise that you're welcome here. Make yourself at home.
Hello, everybody. Welcome. We're very excited that you could join us this morning. I'm Jo from Working In, and I have Zinni sitting next to me here. Well, first of all, I just wanted to say to you that, we welcome all the health professionals that are joining us this morning. It's a real privilege to be able to talk to you all. And also, thank you so much for all the fantastic questions that you sent through. This is a little bit of a different sort of session for us in that we thought what we'd do is find out the sort of pertinent questions that you want to know about moving to New Zealand and put together this session based on those questions. So hopefully you'll find that everything in here does meet what you're looking for, but please do use the chat function if you do have any other questions, and we will try and address those. Otherwise, we will be sending email communication to you afterwards with some follow-up to those other questions. So I guess the first thing is just a little bit about us, so you know who we are and how we can help you. So first of all, I'll just kind of hand you over to Zinni, who's obviously sitting right here. Zinni, so tell us what you do and what you love about New Zealand.
Yeah, so hi everyone, welcome to this webinar. So yes, my name is Zinni. I am a licensed immigration advisor. I also head up our wonderful team. We have 17 licensed advisors now.
Yep, huge team.
One of the biggest, I think.
One of the biggest in New Zealand, yeah.
So what I love about New Zealand is I think the balance. I mean, we come to work, but then we're so close to the beach. We could just go for a walk around the block by the beach, for watching the sunset and things like that.
Yeah,
we're so close to nature. It's so accessible.
It is, yeah. And Zinni and I both work in Auckland, which is where our head office is. And we've worked here for a number of years, and both migrants ourselves. So we've done the journey. Personally, I mean, I just love New Zealand. You just can't beat it. I'm an ocean swimmer, so it's perfect for me. Although I didn't get into that until about 3 years ago. But everything's right there for you. And I can honestly say that the quality of life is absolutely here that you're looking for. I just wanted to say a little bit about the business Working In, just to give you some context around who we are. So Working In, we've been around for over 20 years, and we are recruitment and immigration specialists. So we have been helping people from all over the world to move to New Zealand for over 20 years. It's what we know, it's what we're experts in, and it's what we really love doing. Okay, well, without further ado, let's move on to talk about your questions. In fact, I will just add that what I do know is some of the people that sent through questions are already kind of on their journey as well. So I guess, use that as your kind of driver to know that there's people on this webinar that are already actually making the move. So, okay, let's move on. And what I'll do actually is I'll just give you a little bit of background about working in healthcare in New Zealand. So I'm just going to pop up a slide for you to have a look at. So as we were just saying about the quality of life in New Zealand, working in healthcare in New Zealand and the feedback I get is that, there's a really high standard of care. So patient safety, timeliness, efficiency, all the things that were sort of graded on in New Zealand are really high. We've got lots of modern equipment, and lots of our hospitals are being expanded, new facilities added, and we've got a new hospital being built in Dunedin. There's so much going on in the industry, I guess, to kind of cope with the growing population. and also the aging workforce as well. One thing as well that's, I think, really pertinent is that we hear is the positive and friendly culture that people kind of walk into. I was talking to one of the candidates that I brought here the other day, and she works in the emergency department at one of the hospitals here, and she said she couldn't believe that she gets stopped by her manager to tell her to go and have a cup of tea, and so rather than doing 16-hour shifts with no breaks, she's actually here and being told, off you go and get your cup of tea. So we definitely understand from all the people that we've helped to move here that they do definitely experience a better and more sort of relaxed work environment. So moving on to your the first question, what we've done is there was a lot of questions. So we compiled them into sort of key groups. So a lot of people were asking about what the job market is like in New Zealand at the moment, what are the job opportunities? And so the way I can answer that is, firstly, there is huge demand. And I would say that most of you on here will probably know that. So whether you're a doctor, whatever specialism you're in, whether you're a nurse, whether you're a midwife, if you're in allied health, there's some really great opportunities in very different locations as well throughout New Zealand. And so we can help you with those opportunities. We can get you to New Zealand, and we can match you up with the right opportunity in the right location. There's obviously public-private hospital opportunities, working aged care facilities, working in the community, being in primary care. So really across the board, we can help you. And we are very well connected throughout the industry. And I'm just actually going to pass on to Zinni and ask Zinni about the green list. So tell us, what is the green list of occupations? Because that's something new, isn't it?
Yeah. So the green list, actually, Immigration New Zealand announced this list a few weeks ago. So a lot of you would have heard of the long-term skill shortage list. This is similar to it, but it's not the same. But I think what's important to highlight is health roles is on the green list, as it's been on the long-term skill shortage list. So it's been on the forefront of the New Zealand policies that health workers, healthcare professionals, these roles have always been in shortage in New Zealand. So to fill those gaps, we really want to attract migrants, skilled migrants, into those roles. And so the green list was created, similar to what was the long-term skill shortage list. Occupations on the green list will have a pathway to residence. So a lot of your nurses, healthcare roles are on this green list. So you have easier for you to come to New Zealand for a job, for that accredited employee work visa. But also there are opportunities in September, a new pathway of residence will be opening. Or alternatively, a 2-year pathway to residency.
Well, we'll cover more of that in a little bit, but I guess what we're saying here is that it is recognised that the need for health professionals in New Zealand means that Immigration New Zealand are providing and enabling can I say easier pathways, Zinni? Got to
more
be careful.
Streamlined pathways.
That's a better word. More streamlined pathways for health professionals. And so, it's all about attracting you and into the country, but also giving you those options to get residency, because we know that a lot of people move here, want to move here permanently, move with their family and settle. And so Immigration New Zealand, their new policy does recognise that. So just in summary, sorry, I just realized I've still got the question up on the screen. In summary, there is a huge amount of job opportunities. And so whatever you are doing, we in health, we want to talk to you, and we will talk to you about what those specific opportunities are for you, and assist you on your way. So one of the other questions that came up quite a lot from everybody is this one, which is, what do I need to be able to live and work in New Zealand? So look, this is quite a big question. And so Zinni, I think that there's sort of three things that we talk about, isn't there?
Yeah.
So do you want to explain those?
Yeah. So I think we all know that if you want to migrate to New Zealand and you're not a New Zealand citizen, you would first need a visa. So most people come here first on a temporary visa. And for health roles specifically, there are two other things that you require. So one is registration, because that's mandatory for you to undertake that profession in New Zealand.
Yeah.
And the visa also requires that. So if your role has a mandatory registration requirement, Immigration New Zealand also wants to see that, because if you don't have registration, you won't be able to perform that role. So visa requires that registration. And the other thing, of course, if you're applying for a work visa, which most people will be, you need a job offer from a New Zealand employer. Yeah. So these three things. You
can't avoid them, basically. So those three things are key. So we'll talk more about those three things as we delve into further questions, but we really just wanted to get it clear in people's mind that that registration to be able to practice in New Zealand, you need the job offer, and you need the visa. So those three things. So moving on from that, I think there was a lot of questions about registration. And so what I thought I would do is just have a bit of a general chat about what the requirements are. Now, when I say general, I'll give you some guidelines, but there are multiple authorities, obviously, in New Zealand. So there's different registration boards, and each of them have their own requirement. So depending on your profession, so if you're a nurse or a midwife, or you're a physio, or you're a GP, and there's different registration boards. But loosely kind of speaking, you need to be obviously qualified in the area that you're going to practice in. It's only tell me if I miss anything when I say these things. So you need to be qualified, and you need to have experience post being qualified, but also post being registered in the country that you have qualified. Normally that's 2-3 years, but that depends again on the registration board.
And recent years as well.
And recent years, that's a good point. Yeah. So I know for the Medical Council, it's the last 3 years. I think it's midwifery and nursing is 2 years post-registration experience. So there are sort of variables in there. So you need to have current registration, you need your qualification, you need your post-registration experience, fitness to practice. So that's getting your
police
checks. The other thing as well is, if you are not from a country where English is your first language, then you may be required to complete one of the approved tests. So there's quite a few stipulations around that whole English language, isn't there, Zinni? You can sort of, if you're from a country where English is not the first language, but then you've worked somewhere where English is a first language, you might not need to do the test. If you've maybe worked in a clinical setting that's English, you might not need to do the test. So it's a really important, I guess what I'm saying is to look at those individual requirements. There's 2 tests. One of them is called IELTS, the International English Language Test, and the OET, which is the Occupational English Test. So generally, for all the boards, these are the two that are approved. That's right, isn't it?
Yeah. Yeah.
So registration is key. If you haven't started your registration yet or even looked into it, then we recommend that you jump online, check the registration board that you would be affiliated with, check that you meet the registration requirements, and then start the registration process. And because normally that can take 4-6 months, even more, can't it? So
yeah, and I think with the English test, I think you need a required score across all bands. So listening, reading, writing,
speaking.
Yeah.
Yeah.
And I think a lot of people, you could get maybe 6 and 3 bands, but then not meet the required for another, for example. And I think specifically for registration, you need a minimum number across every single one. It's not an average.
It's not. You need 7 in each of them. And so, but you can retake the test. Within 12 months. So you retake the test and the score, and they'll compile the scores basically from those tests. So that's really important to get on and have a look at that. And of course, we can help you. We can help support you with that. If you've got questions or you need anything explaining, we can certainly help with that. So what we'll be doing at the end of the session is we'll send you a link that you can complete, and then we'll get in touch with everybody individually. So as we said, registration is key, and that was a question that a lot of you were asking about. The next thing that is obviously key, we had lots and lots of questions about applying for a visa, and we know that it's quite a complex subject. Yes, because of the changing policy, and there's a reason why we've got 17 licensed immigration advisors, and we're like the second biggest in New Zealand, because it's such an important service, right? Isn't it?
Yeah.
So I'll let Zinni just run through. I'm going to pop up another slide, which is just going to show you some of the key questions that we've had. So Zinni, I suppose that the first thing is people are sort of saying, well, what do I need when I apply for my visa? So
I think here we're just going through general big brush strokes rather than into the detail, because
totally.
Every single person is, your situation is very different. I think as a general rule, each visa application, there are 2 mandatory things to meet. So one is medical, so once you're good health, and the other is character. So you have to have good character to apply for a visa. If you have some minor issues, that's okay, because we can help address that. Sometimes you do need to put in a submission to say, I've had the police record since I was 20 years old. I was young. I made a mistake. Those sorts of things we could assist with. Putting a submission together and still address that with Immigration New Zealand and say, despite that, you're still a good character.
But I guess the key thing is that what we need to know is being upfront.
Yes, exactly.
And telling us at the beginning, so that we can plan to help you with your situation. So it's being transparent is really key. So what I guess what's the process, Zinni, and how long does it take? Can you just kind of explain that as sort of top line, I guess, as you can, without going into detail?
Yeah. So generally, I think I mentioned before, most people apply for a temporary visa first, because that's usually much quicker than residency. Residency, a lot of times it takes about, I would say, average a year. It could be longer, it could be shorter, depending on the category that you're applying for. Whereas for temporary work visas, the processing times are usually 2 to 3 months. So you can get to New Zealand quicker. And along with those applications, of course, you need to provide, your medical certificates, your police checks. If you're applying for a job, you need to, a lot of cases, prove that you have the work experience, your qualifications.
Yeah.
So I think all of these paperwork sometimes do take a lot of time to put together.
But with that though, if they've got their registration, a lot of that is part of that registration process as well, isn't it? Because that's mandatory. So
so you would, so that's good to get started on the registration, because if you've got all the paperwork for the registration, a lot of that you can use for the actual visa application.
That's right.
So, first step
Yeah,
registration.
well, it does, and so it helps you get organised. And so a couple of other things then was that we got asked quite, well, can I bring my partner? Can I bring my children with me? How does that work from a visa point of view? So I think this is a really key question. So if you could just talk to that as well.
Yeah, because most of you want to migrate with your family. If you do have wife, husband, kids, partners. You can bring your partner along. There will be some changes to the rules in the future, but I think for roles on the green list, you are still able to support your partner, and they can apply for a partnership-based work visa. So they don't necessarily need a job offer themselves to apply for that visa. And
that's really important, isn't it? If you I can just pause a minute, because what a lot of people do that I have certainly helped in the last sort of 3 years, particularly during COVID when it was so blooming hard to get here, for a lot of people, is that health professions had the pathway. And so if the principal applicant has a job, then the partner can come into New Zealand on a partnership visa without a job. That's right. And then when they get here, can look for a job. So that's what a lot of people do, because it can be hard to kind of juggle getting both people jobs at the same time. That's right. Okay.
The key is you have to meet the living together criteria.
Yes.
For temporary visa, there isn't a minimum time, but usually we say 3 to 4 months, because you want to show that your relationship is established. It's likely to last. So those are the key requirements for partnership visa.
And that's not that long.
No,
3 to 4 months. And you could always put things on pause and kind of change your situation if that was going to help. So okay.
But for residents, however, for your partner to be included, you need to live together for at least 12 months. So that's why you come on a temporary visa here first, and then here you can, continue collecting evidence of living together and then apply for residence when everyone's ready.
That makes sense. Okay. Now, another key question that came through, and I get this all the time anyway, and I think you do, Zinni, is there an age limit? So it seems to be quite a big question. So So
I think it's a little bit confusing, because the age limit depends on what type of visa that you're applying for.
Right.
For the new work visa that's coming out, so the accredited employer work visa, that's taking effect on 4th of July. There is no age limit, no age requirement for that work visa. So you can come here regardless of your age and work. But if you are applying for residence in the future, either through the skilled migrant category or the new accredited employer work visa, that resident stream that will be opening up, the age limit is 55 or under. So
basically what you're saying is that if you want to come here and you're happy to be on a temporary work visa for, how long is a temporary work visa for normally?
So you can get up to 3 years on a temporary visa.
And can you extend that? Or
you can renew it, as long as you retain that job offer, continue to meet the requirements. You can renew it indefinitely.
So basically, if you want residency, if that's your goal, then obviously you need to be under 55 or 55 and under, sorry. I know that. But if you are not intending to come for permanent residency, then there's still nothing to stop you coming here. If you want to work, but obviously you've got to get the temporary work visa, and you'll need the job and the registration, as we were talking about before. And so I think that's a really good option for some people. And also you get people that I find that might just want to come for a couple of years and see what they think.
Yeah.
Or
exactly.
they want to come for an experience.
A lot of people do come for an OE here in New Zealand, so that is an option.
Yeah. Perfect.
Yeah.
Okay, so it's,
can I just say on
yes.
the age limit, because I think that's for the principal applicant, but then a lot of people will be bringing children.
Yes.
So for children, there is also an age limit.
Yeah, good point.
Yeah. So for temporary visas and for residents, the age limit for your children is different. So for temporary visa, so if you're applying for a work visa and you want to bring your child here study, the maximum age is 19 years old. So that's up to secondary school. But if they're wanting to study, university or undertake any tertiary studies, they can still do that, but not as your dependent child. They would need to apply for their own international student visas.
Right. Okay.
Yeah. So that's for temporary.
Okay.
But for residency, the age limit is 24.
Right.
Yeah. So it's a little bit higher for residents.
Okay. So that's lots of information there, Zinni, about the visas. And I think so what we just would like to share with you now, because there's so much to understand, and the new policies, everybody's got their individual situation, and so we'll just spend a couple of minutes just explaining what our service is and how we can help secure you a visa. So Zinni will just sort of explain the steps to that and what we do.
So I think the first step for anyone really is to check if you're eligible to apply for a visa, because you might have questions for yourself or your family, and we do an eligibility assessment for you. And that's essentially your roadmap to New Zealand. So what are the types of visas that you are eligible for, and for residency, what are your options? And we do that. It's called a My Visa Pass.
Yeah, and there's a small cost for that, isn't there?
Yeah, it's $299 New Zealand dollars. So it's just a very small fee. And one of our licensed immigration advisor will actually sit and look at the details that you've provided and come up with a report for you. And following that, you could have a consultation with our advisor as well. So you could ask questions.
So, and that's all included in that $299. So you get your assessment, you get a detailed report, and then you're getting a one-on-one consultation to talk through that so you can understand. Okay. Okay, that's great. And with what we do and the information that we provide, I mean, if you want to, if residency is your goal, then obviously we put you on that sort of pathway to residency. And I just wanted to make a note here about visa costs, that if you do your own visa, then obviously you've got the disbursements from Immigration New Zealand. And then if you want to use our service for visa, then we will give you a quote according to your needs, what type of visa you want, your family situation, etc. So that will all be made clear up front.
So before you even sign up. So after the consultation, of course, we'll give you a quote on what service that we're assisting you with. So the temporary visas, or if you don't want residents, you don't have to sign up for it. And each individual quote will be tailored to you.
Cool. Okay. Awesome. Well, hopefully that gives you some good insights into getting your visa. Now, the next biggie, the next big question, and it's a big topic, and I'm just looking at the time thinking, okay, right, well, we've got to make sure we don't go too over time. But the next big question is, how do I go about finding a job? So there's kind of lots of factors under here, really. Lots of advice that I can give you, and also support that we can give you with our service too. So I'm just going to run through, I guess, that process of finding a job. And so one of the key things that I kind of refer to and we talk about here is being job ready. And it's just a term that we use. And so being job ready means that you are ready and in a position to apply for a job where you are going to be considered for that role and kind of be almost on a level playing field, almost with a local candidate, really, right? And so really what that means is that you're eligible for registration. You've made a start on your registration, because that really shows your commitment, and that commitment is really important.
And we have had feedback from employers saying, I chose that candidate because they already have their registration.
That's right. Yeah. Well, and you're right. A lot of employers that, I've got a network all throughout New Zealand with the healthcare providers, and a lot of them won't consider a candidate unless they've started their registration or they've got their registration. And a lot of the reasons for that is then they know that you are eligible, but also it enables them to have a bit more of a clearer time frame as to when you're coming to New Zealand, because otherwise it's kind of out of their control, and it could take you 12 months to get to New Zealand. And I guess a point on that is there is some flexibility on a start date. So once you've got your job offer, we can negotiate your start date, and it's often tentative. And so we'll work with you on that. But the key really is to go into this process having done some research, done some planning, have your CV ready. You want to be looking for a role that matches your skills. So it's not a time to make a career change either. So if you've worked as a scrub nurse for the last 5 years, then look for a job as a scrub nurse. That's your best bet, and continue. It's moving is challenging anyway. You don't want to be trying to kind of sort of do anything different. So CV, have a look online, see what sort of roles are around. But what I will say is that the very best thing, as I said to you, is being job ready. And if you're firing off your CV to lots of jobs online, kind of unsolicited really, you might be disappointed. A lot of employers may not even respond to your application. You might just not even get anything back, no interviews, etc., which can be super disheartening. And so what I will say on that is take a considered and planned approach. So really think about what you're doing, where you want to work, what's your location. And this is what we help with. And so if you want somebody on the ground who is going to help you and advocate for you and put your best foot forward, then myself and my recruitment team can help you with that. So we provide a really comprehensive service, right from the start of reviewing your CV, guiding you with your CV. I'll just put another slide up here just to sort of tell you a bit more about what we do. And so I'll meet with you, do a bit of a sort of informal interview, understand your skills, what you're looking for, what your timeframes are. We'll put together an action plan for you, give you guidance and support with your registration. We've got lots of roles throughout the country that are not advertised, because I'm working with employers that are planning sort of further ahead for roles where they're happy to accept applications from candidates that they know might not be here for 6 months or 12 months. And then that's really important. We'll also review your employment contract, help you with interview preparation, and make sure that we can get you a relocation package as well. So a lot of people ask that question, is there a relocation package? And so we'll try and make sure our best to get you some financial support with your relocation with your job offer.
So it's really, I think, preparing your frame of mind, putting yourself in that position to apply, and that really shows the employer that you are committed to this journey. Because lots of people put in applications, but employers don't know who is actually committed, who can actually get here.
Yeah.
So it's not showing them that you are ready to make the move.
And you're serious about it. Yeah. And if we've done an eligibility assessment as well, then that means that we can tell the employer that not only are you eligible for registration, have started your registration, but also that you are eligible to get a visa. Yeah. So you can see how suddenly, and then you've got this great CV, we've spoken to you, we've put this awesome profile together for you. So suddenly you can see how you can be job ready. And, you know, I guess I'm proud to say that a lot of people that I work with, pretty much they only have 1 or 2 interviews because we are really conscientious, I suppose, with finding the right employer and the right role to put you in front of the right job so that you've got really good success of a good outcome with the interview. And so what I will just add there as well, the final thing I'll just add on that side of things is that there is no cost for our recruitment service. So yes, we've talked about there are costs associated, of course, with the visa, but with finding you a job, there's no cost with that service. And as you can see, you know, Zinni and I work really closely together. We've got the huge advantage of our business of how many people are in the business now? 45, growing all the time. And probably like last time we looked, it was 45. But yeah, we're certainly a growing business. You know, there's more and more demand for our service, but we're in this unique position where, because we've got in-house recruitment and immigration, we work really closely together and can offer a really seamless service for you. And
we also work closely with a lot of employers too.
Yeah, exactly.
So it's not just the individuals, but it's also employers needing to go through that visa process, that immigration process. There's some changes happening. So making sure that they meet their side of the requirements to be able to support you on a visa.
Yeah. And that's even more important now because all the employees have to be accredited from 4th of July.
4th of July.
Do you want, actually, I'm just looking at the time. We don't want to, we are probably going to go a few minutes over. So sorry about that. But maybe just a little note on employees need to be accredited from the 4th of July.
Yeah. So essentially it's mandatory for any employer wanting to support someone on a work visa to get that tick from Immigration New Zealand, say you're a fit employer, you've got good financials, good processes in place to support a migrant worker with a job. So from 4th of July is when that new AEWV takes effect.
That's the accredited employer work visa.
So that is stage 3 of the application. That's relating to yourself as the individual applicant. But prior to that, first stage is accreditation. Second stage is the job check. So employers saying, we want to recruit for this specific role. Once they have that approval, then you can then use that job check token, they call it, to apply for a work visa. So it's 3 stages. We work with employers on the first 2 stages, and we work with yourselves on the 3rd stage.
So what we're saying here is not only do you need to be prepared and have the visa, but the employer needs to have done what they need to do, which is having the accreditation and the job tech to be able to hire you. So we work with the employer as well. So I guess there's another advantage of working with an organisation such as ours. Okay, right. Well, there is another question, and that came up quite a few times. So I'm just going to cover this off swiftly, which is, what are the costs of relocating? Look, I mean, it's kind of a tricky one to answer, because it depends on how many people are in your family.
Do you have pets?
Do you bring in pets over? What country are you coming from? As to what your flights might cost, etc. But you know, what I will say is it's not a cheap exercise. And so, you know,
you're shifting your life from one country to another.
You're shifting your life over. And so, you know, you've got to think about the cost of the visa, getting your medicals, getting your police checks, if you're shipping your things over, your flights,
if you're selling your house,
yeah,
if you're
going through all that process, setting up your new life here. And so I guess the important thing is to say here, though, is it's attainable, work towards it.
People have done it.
So many people have done it, put a plan together, budget. If you're thinking about it now, but maybe you decide that, well, you can't afford to move until 2025, but that's okay. Just move towards that goal, because you won't regret it, I can tell you. And as I just said before, some employers will give you some support with your relocation costs, which will generally be possibly your flight. Some might pay for a bit of shipping, but it really depends on the employer. So again, it's hard to say. We do have a sort of team of relocation partners as well. So we've got some preferred suppliers there that we can refer you to as well when it gets to that point in the process. Okay, so I am hoping that we've managed to answer most of the questions that you came up with. Zinni, I'm just going to ask you to kind of just summarize a little bit about those sort of steps now to kind of get you started. If you want to just run through this, and you'll see a slide up on your screen here just to sort of reinforce what we're saying.
Yeah. So just to recap, for most health professions, you need registration with a New Zealand board. So the first step really is check that you meet those requirements. And if you're really committed, do take that step.
Get started.
To apply. So put together those requirements, take the English test if you need it, get that registration underway. And at the same time, we can do an eligibility assessment to check your, what your visa pathway is, and map it out for you. And then on the other side of it, because you need a job offer to make that move, so put together, your CV, update it. Sometimes you might not have in the last 5 years, make sure it's updated so employers can see what your recent experience is. And I think definitely set a time frame towards when you want to make the move, because you can plan backwards, and also budget, like Joe, you've mentioned. And do a little bit of research of which area in New Zealand.
Where do you want to live? What are you into? What's your passions? Where do your family want to live? Where's think about schools or whatever. There's all that kind of stuff.
Do you want to live in Auckland City, or do you want to live down in Dunedin?
Or do you want to live more rural? What sort of lifestyle are you looking for? And that, sorry, did you mention timeframes? It's getting that whole sort of thinking about when you want to move, and
because it's not going to happen immediately. And it will take time to apply for a visa, apply for that registration. So plan ahead, and be flexible as well.
Definitely.
Things will change, policies do change, plans change. But if you're prepared for it, then you're prepared for the change.
And I think the other thing is just to give people a rough idea of timeframes. That if you were to apply for registration today, you could realistically get your registration, get a visa, and probably be here in 6 months.
Absolutely.
So that is very realistic. Of course, if you're further along with your registration, or you've got your registration, then you could be here in maybe 3 months. So, but that's probably the minimal. So 3 to 6 months is really the minimal time that you can work towards.
Definitely.
But we'll work with you. That's the thing, is that we give you tips and support and guide you on those steps all the way. And then also, obviously, we talked about the costs of relocation. So sit down and kind of have a think about what it's going to cost you and your family to get here. Okay, so that kind of sums up all those questions for today. We hope you found that really useful. We've certainly enjoyed being able to share our knowledge to you. What we're going to do just now is you will find in the chat a link to an online form. And so you can click on that form, and once you've completed that, we will review it. and we will get back to you individually and guide you on those next steps and what you personally need to do next. You'll go through that eligibility assessment process. You'll meet with myself. We'll talk to you about what your individual plan is. And then, we hope to be meeting you on this side.
Yeah.
As soon as you can get here, we'd love to help. Hopefully, it's been useful. And Zinni, have you got anything to add?
Yeah, I think it might seem overwhelming, but really breaking it down, that will really help you. And you only really need to take it one step at a time, and we will be guiding you along the whole way. We'll say, this is what's next, this is what's next. So you don't even have to really think about it.
Yes, and that is such a good point, because a lot of people say, well, I don't know where to start. And then they jump online and there's just information overload. So use us here. We consider ourselves to be experts, and we'd love to help. So thank you again for joining us this morning. We will hopefully be in touch soon, and look forward to assisting. Thank you so much.
Thank you, everyone.